Morning Talk with Siki Mgabadeli.
It's 6 minutes past 10. We're going to talk now about HIV, but talking specifically about ARVs, how to cope and deal with the side effects that come with them. We've seen some negative stories in the news lately on this particular subject. However, it's also fair to mention that ARVs can have severe side effects, just like any other medication, whether it's for TB treatment or cancer treatment. But what must one do if you are experiencing some really severe side effects? If you do have any questions, maybe you are suffering some side effects, you can give us a call on 0891104207, SMSs to 34701. In conversation with Dr. Francesca Conradi, who is with the Right to Care's clinical advisor to the Sizwe Hospital. That's a hospital for the treatment of multi-drug resistant TB. Thank you so much, Dr. Conradi, for your time this morning.
Thanks very much for having me.
And we have seen some really bad stories in the media. Are those just isolated cases? What do you make of them?
Well, I'm sure the cases that we're referring to are the massive boob stories, where women had hugely increased breast tissue. They're very, very uncommon. In my time for treating HIV, I've seen a couple of men who've developed breast enlargement, but only one or two women to that extent.
Okay. What causes that? Would that be the individual woman's own body?
It's a combination of two things. The first thing is that some of the antiretroviral therapy, actually, you lose fat in certain areas.
Okay.
Around your face, around your bums, you lose a little bit of fat. And then if your breasts get a bit bigger because you're gaining weight, it becomes very accentuated. The way to deal with it is if you start to notice an increase in your breast size, you go to your doctor or your nurse and you tell them that this is the problem. If it does persist, then sometimes surgical removal of the breast tissue is all that can be done.
Now, to be fair, I mean, since the very first batch of ARV medication, there have been huge improvements in the drugs themselves. So have the side effects then become much less since the first order?
Much, much, much less. Originally, we had medicines that caused this lipodystrophy that I've talked about just now, as well as a fatal complication called lactic acidosis. We've pretty much got rid of those, although a couple of people still remain on them for various reasons. So not everyone gets a side effect.
Yeah.
But we've gone from our original antiretroviral therapy being somewhere in the order of 16 tablets a day, some to be taken with food and some not to be taken with food, to now single day dosage. So you only take it once a day. In the government service, it's 4 tablets once a day. And in the private, it's only 1 tablet once a day. They're the same medicines, but just not yet co-formulated.
Okay. And what was the other thing? The lactic
acidosis.
What is that?
You know, when you exercise a lot, you get stiff muscles.
Okay.
And that's because your body has gone from using oxygen as its principal energy source to anaerobic respiration without oxygen. Now, some of the medicines can block our body's ability to use oxygen, and we get an increase in lactic acid. And it starts off as a very subtle kind of, my patients would say that they feel unwell.
Okay.
They're just tired, they lose a bit of weight. If it's not picked up soon enough, it can be fatal. The drug responsible for that we call it the D drugs, D4T or stavudine. And that's largely being phased out of all programs.
Okay.
Because of this particular side effect.
What are the typical side effects that an ordinary person on these medications, whether it's the 4 once a day in the public service or the 1 once a day in the private service would get?
Again,
what should people look out for?
The two are very similar. I think the most striking side effect that we see, and it's a very, very common one, is with the drug efavirenz. It's part of both regimens. It tends to make people get what we call neuropsychiatric disturbances. And it's so common that I tell my patients to expect it. We only give the medicines at night, so you sleep through a lot of them. But almost everyone will come back after the first month and say, I had strange dreams. I woke up at night to go to the loo and I was really dizzy. I nearly fell over. But it's a short-term side effect. It goes away on almost all patients.
Okay.
Then the other 2 drugs, what we always check for is to make sure that our patient's liver and kidneys are working well. We do blood tests. We call them safety bloods at every visit. And we can get side effects on that, but then we're looking for them. And if we find them, we know exactly what to do next.
And what would that be?
Change the medicines.
Change the medication.
Yes.
All right. In conversation with Dr. Francesca Conradi this morning, we're talking about ARV side effects and, of course, also how to cope and deal with them. We're going to take your calls on 0891104207, SMSs to 34701.
Morning Talk with Siki Mgabadeli.
And it's 12 minutes past 10 here on SAFM 104 to 107. So talking just about taking the medication, what happens if one misses a dose? Because we've talked about the people with TB medication just skipping the medication, and we know what happens there.
Yeah. In fact, the situation is almost identical with TB and HIV. If you miss tablets, you can develop resistance. TB is a far more slowing organism, so it's a little bit more forgiving, but please don't miss any TB tablets, guys out there, listen. And it's the same thing with HIV. If you miss your tablets, you can develop resistance. And then the medicines stop working. We do have a first and a second line. The first line is this one tablet or single day dosage. Very easy to take, works very well, saves gazillions of lives, which is a medical term, by the way. It really works very well. But we do have a second line.
Yeah.
More tablets, more side effects, much more expensive. So the best thing to do is, if you're prescribed antiretroviral therapy, just never miss a dose.
Yeah.
Let it become part of your life. And you only have to remember for the 5 seconds that it takes every day for you to swallow your medicines, that you're in fact HIV infected.
And the importance of nutrition. Let's talk a little bit about that. I mean, we know we live in a country of great inequality. Some people do have money to go and buy nutritious food, while the vast majority do not.
Yeah. In fact, we always think of malnutrition as being really skinny. And we think, it's the skinny people, that's the problem. But in fact, we tend to eat the wrong things more than anything else. I'm a little bit of a carbohydrate addict. It's not good for me.
Yeah.
And because you get these insulin imbalances. But to be trying to eat, more protein, fresh fruit and vegetables. We do give supplements for some of the side effects of the drugs, some vitamin Bs to help with certain things.
Okay, so that would assist maybe with the nausea or diarrhea. Would those two also be some of the side effects?
Nausea it's very common in the first couple of weeks, but that's not uncommon for many medicines, even the oral contraceptive. You feel a wee bit nauseous once you start taking the medicines. Diarrhea, it's not such a big problem with the first line. Second line, big problem. That's why, if you prescribed your medicines, please don't miss a tablet.
Yeah.
And a question that's often asked of me is, so I'm HIV infected, I'm going to take my medicines, how long will I live?
Yeah.
I think we all want to know the answer to that question. If you stick to your medicines, your life expectancy is probably close to what it would have been if you were not HIV infected. So we're not measuring it in a couple of years of poor quality of life. We're measuring it in decades of good quality life.
Okay.
Provided you don't miss a tablet. And believe me, I know how tough that is.
Yeah.
Sometimes we have disorganized lives. Another thing is sometimes I was recently diagnosed with high blood pressure. And I found it quite tough. It was this whole thing of looking at my mortality of my failing body. And I understand now probably more than ever how difficult it is.
Yeah.
Because sometimes I just don't want to have it.
Yeah. Yeah. And that fear, people in the past, of course, because of and as I said, the old order drugs, people were very afraid of going, firstly to get tested, and then once they tested, to actually take the medication. Is there a drive to just raise awareness about the importance of taking the medication?
Well, I think what we did last year is the Department of Health launched a massive testing campaign. The Minister of Health is just a phenomenal leader in the health department. And we tested over 15 million South Africans. But we didn't see a massive upsurge in the amount of people that started taking treatment because we're missing the gap between being diagnosed and starting your medication, so entry into care.
Yeah.
I'm not sure how to deal with it. There are lots of ways that we can think of encouraging people to go to get treatment sooner. But it is quite a difficult thing to be quite well and then to have to, attend clinic visits, etc.
Every month and take medication when you actually feel
Yes.
that there's nothing wrong with you.
Yes. It's similar to having high blood pressure. You don't feel anything, but if you leave it, then you can end up with devastating consequences. You can have a heart attack or a stroke. And HIV is the same, that it's kind of insidious. You don't necessarily know it's there. But you don't want to find out it's there when you present with some terrible infection.
And often, is that how we discover what is wrong with someone? Are they presenting at a very late stage?
Still, yes. The groups that present earlier for medical care are pregnant women because
They have to go for prenatal care.
yes,
Yeah.
and we've pretty much made it that, you can opt out of having an HIV test.
Yeah.
You can choose not to have it. But I think that in many ways, once you're pregnant, you give up many of your rights. You have got to do all that you possibly can to ensure a healthy baby. And the uptake is very good, and we've done well on that. But still, a lot of people walk into our hospitals literally on death's door.
And by that point, what can be done?
Look, I really love my job because we see very amazing cases of people who are literally on death's door. People I've looked at it and thought, I think the priest would be more useful than me right now. But I've done what I'm trained to do, and those people go back to work. Now, the problem with it is that sometimes these infections, even though we can treat them, they have sequelae. They leave things behind. If you have tuberculous meningitis, the chances are that your intellectual functioning will be somewhat impaired thereafter. And that's a great pity.
Yeah. Because it means you probably can't go back to work.
Or maybe not achieve what your potential was. You can't achieve at that same level anymore.
And how soon should one start taking the medication?
We've at a CD4 count of 350 or below. Most people at 350 are still quite well. Sometimes they might have minor skin manifestations, but the government has decided, and I wholeheartedly agree with them, that we should be treating people before they get sick, and that's a CD4 count of 350. If the patients have got TB, particularly drug-resistant TB. And another thing that's quite interesting about this HIV treatment is that it protects you from getting sick, but it also protects your partner from becoming HIV infected. So the more people we treat, it will be one of the ways that we control the HIV epidemic.
And is that message? I mean, I've heard it because I'm obviously in tune and have to pay attention to this kind of information when it is being disseminated. But are we talking about it enough?
I'm not 100% sure, although when I speak to my patients, particularly those who are in a discordant relationship, they say, I don't want to be sick, but I also don't want my partner to be infected.
Yeah.
And I now see the reason that I have to take these medicines for myself, for my children, and for my family as a whole. And if you're taking your antiretrovirals correctly, so don't miss a dose, you're almost non-infectious.
Let's take a call from Peter in Johannesburg. Hi, Peter.
Hello, how are you?
I'm well, thanks, Peter.
I'm well. Okay, I've got a friend of mine who is also diagnosed, right? So the problem that she has is that she has breathing problem, and it's been happening ever since she started taking the medication. So I just want to know, she went to the doctor, and then they say that she cannot, the problem is with the medication. But then when they spoke about the another medication, but then that medication also they said it had side effects with what you mentioned earlier with the nightmares and stuff at night. So I just want to know if there can be an alternative to that medication, maybe.
You say breathing problems. Is she coughing, short of breath?
It's short of breath.
Short of breath.
Yes.
Doesn't really sound like a side effect to the antiretroviral therapy. Certainly not if she's just started her medicines. But you know what we do in medicine is that we do research and we come up with what we think is the best regimen based on a whole number of things, mainly efficacy and safety. So does it work and it doesn't do our patients any harm? But we're all individuals.
Yeah.
And as they say on Monty Python, no, I'm not. But we're all individuals and we start somewhere. We give a patient a standard regimen. If they get a side effect, then we have to try something else. And I think don't be despondent. Go back to the doctor and see. You know, the nightmare side effect, I tell my patients it's coming because otherwise it's frightening. And I know I wouldn't trust my doctor if they didn't warn me about it. But go back to the doctor and say, let's try something else. You know, these medicines are going to be your friend's friend for the rest of her life.
For the rest of her life.
So she's got to find the best one for her. And they're out there.
Okay, all right.
Okay, just tell her to just go back to the doctor, maybe try something else, eh?
Not to lift her bottom off the seat until she's got an answer to her problems.
Yes.
Okay, thank you.
Okay.
Thanks, Peter. Charles in Heidelberg. Hi, Charles.
Hello, Siki, and hello to the doctor.
Hi.
I've just got a question. I want to find out what is the relations between the ARVs and taking like a products called like cell food to assist and curb the side effects of the toxic side of the ARVs. Can it assist if there's a patient who's taking ARVs, or is it just a stunt from those companies' side?
All right. Thanks, Charles. Listen on the radio now.
Yes, I'll listen on the radio.
Okay, bye.
You know, the really serious side effects that we talk about, things like kidney problems, liver problems, we need to change the medicines, and cell food is not going to make much difference on that. It's my personal opinion that you probably get a better benefit. Clearly, I'm a woman, but from going to get your hair done than you do from many of the things that are punted as things that are going to, you know, get a better sense of well-being from it. So I think that there's lots of false marketing out there. Things that will A, improve your immune system, or B, get rid of the side effects. I don't really, not many, in fact, very few of them have been validated. So rather spend the money on something that makes you happy.
That'll make you feel better. Here's one. Andy in Rustenburg says, does a glass of wine, beer or cider have bad effects on an affected person? And then there's another one. Also, can I drink alcohol and take ARVs, from Sipho in East London?
The answer to both of this is yes, in moderation. There are two problems with alcohol. If you drink too much, you can damage your liver. And I've mentioned a couple of times the fact that ARVs can have liver side effects. So you don't want to attack your liver from two sides. The second thing is when we get drunk, we may forget our tablets.
Yeah.
And that's what we call a flippin' disaster. So no, you know, HIV, unfortunately at this stage, we don't have a cure. But it has to fit in with your life. So go out and have fun. Enjoy yourself. A glass of Chardonnay will do you no harm, but not in excess.
All right. Joseph in Bloom. Hi, Joseph.
Hi, Siki, how are you?
I'm well, thanks, Joseph.
I just want to verify if I've heard a good doctor there saying if your partner is on ARVs and I am HIV negative, can I sleep with that person without using a condom?
No.
Oh.
What I'm saying, sometimes we want to sleep with our partners without condoms for certain reasons. For example, you wish to conceive children. In general, we still advise safer sexual practices. But we did a huge study called HP 10052, where we found that when we treated couples, we gave them safer sexual advice and treated one group and not the other group at a certain level. We found that there was almost no transmission.
Okay.
So, you don't need to worry if the condom breaks, etc., etc. But we would still advise the use of condoms except for times when you wish to conceive children.
Okay, but the chances of me being HIV positive are slim.
Provided
if my
you-
partner is on ARVs. Is that what we are saying?
Amen, brother. You got it.
Got it.
So she's taking her medicines because she loves herself and she loves
She loves
you.
you.
Okay, but then if maybe two of you are HIV positive and you are on antiretrovirals, do you have to use condom, or is that reinfection goes on, or what is the status?
Yeah, reinfection can occur, although I don't think it occurs very often. But I have definitely seen cases of what we call transmitted resistance. People who've been given a resistant virus. So if your partner messes up her tablets and she gets resistance, she can pass that on to you.
Okay.
So we still advise the use of condoms.
Okay, thank you.
You're welcome.
Thanks to Joseph. Some SMSs. Someone says, what is the doctor's view on tripler side effects? What is the most expensive ARV tablet, but with less or no psychological side effects?
Okay. A tripler is 3 medicines in one, and it contains the drug that I talked about, efavirenz. So I think I've covered it.
Yeah, but that's the one with the psychiatric symptoms.
With the psychiatric. And remember, I mean, I've stressed them because I think they're scary if you don't know they're coming. But within a month, almost all of my patients have forgotten about it. So, yeah, they're there, but they're almost always settled down.
Is there a really expensive tablet that has little side effects?
There are tablets that have lower side effects. It depends on how much money you want to spend.
All right, so just ask your doctor.
Just ask your doctor, yeah.
Chris, KZN. Hi, Chris.
Good morning, Sigi, and your guest.
Morning.
I think firstly, let's thank the SAFM and your show in particular for bringing up the treatment issues because treatment was only an issue in 2003 and it was raised as a very controversial issue. And now is the time that really people need to start another campaign, not only of awareness, but of educating the public about treatment, which I think your show is doing very well, although the time might not be sufficient. And the last point that I wanted to say was that for treatment to succeed, as we see from yesterday's report, it really needs individual commitment. It will definitely not do anything except to provide the treatment. But if people as individuals are infected and those who really need treatment do not take up one, go and get tested, and when they need treatment, do take them as regularly as they are needed. And also for families and communities to support people who are on ARV treatment. We are definitely not going to win a war against HIV and AIDS. The results released by the minister yesterday are showing that we can save a lot of lives, as he showed that we are saving more than hundreds of thousands of children's lives. But that is not going to be, we are not going to see the fruits in the near future because those children, unfortunately, are going to go back to the community where the risk of them getting infected is high.
Yeah.
So I think that it is very good that we have such a program. We challenge the media in particular because, especially in KZN, you open a newspaper on the classified, the first thing that you see is the alternative and traditional medicines and all these bogus cures for HIV, which is another battle. We hope that FM and the media, and we are lucky in KwaZulu-Natal. I happen to work for government and the Department of Health. The SABC cause in particular have taken up our call to say let's work together to ensure that we educate the public about treatment.
That's our
I think
sister
thank you, Sige, and thank you to your guests. We hope these programs will go on forever.
We shall do that. Thanks to Chris in KZN. And as he says, education and awareness is very, very important. I'm going to take one call from Eunice in Johannesburg, read some SMSs, go to headlines, and then we'll respond to everybody. Okay. Eunice in Joburg, morning.
Hi, morning, Siki.
Hi.
And morning to your doctor. The Siki, I raised an issue about 2 weeks ago, if you could recall, on the drug stavudine.
Yes.
Now, this drug, an ARV, it was regarded by the WHO as being toxic, and it has led to women, especially, those taking ARV treatments with their breasts being enlarged and what have you. So, I'd just like the doctor to expand on that because the health department said that only 10% of the women are affected by this drug. Now, the point is, if the WHO has regarded it as toxic, why isn't our health department immediately stopping this drug and using less toxic drugs which are available for HIV positive people.
Okay.
And I'd like the doctor to comment on that. Thank you.
Thanks, Eunice. We'll do that in a moment. Read SMSs. Talking about ARVs this morning in conversation with Dr. Francesca Conradi, who is with Right to Care. All right, let's deal with the question from Eunice, our final caller, on that particular drug, and then we'll read some SMSs.
Eunice, you're a bit behind the times. On the 1st of December 2010, the government announced a change in our national program to get rid of stavudine and to swap it out with tenofovir. So we are more than aware of it. And at the moment, they estimate that there are still some South Africans on stavudine because not everyone gets a side effect. All patients now are started on tenofovir, which is a much better drug to be using. And we are phasing it out.
Okay, so it is being phased out.
Absolutely, it's being phased out.
Because I think the concern was that there were some people who were still using it.
They are still using it, but if you've been on a medicine for 5 years and you've got no side effects, there doesn't seem to be much good reason to change.
Okay.
But if we don't start new patients on it, and people who get the slightest hint of a side effect are immediately changed.
Okay, and they are moved from that. Here's some SMSs. Can you get an HIV from getting a blowjob?
Please, ladies and gentlemen, the answer is yes, you can. Have protected sex. Let's move along.
And another one, my face is bony. Can you help?
You know, in fact, that ties in with Eunice's question and the use of the drug stavudine or even AZT. What it does is it makes the fat disappear from your face. So you see people with very prominent cheekbones and sunken cheeks. What you need to do is you go to your doctor or your nurse and you say, please change me from this medicine to another one.
Okay.
It's quite safe to swap out single drugs in an antiretroviral regimen if the patient has an undetectable viral load. So if they're on the correct medicines, they're working, you can swap them out.
Okay. And here's one. How effective are antiretrovirals when taken with cow dung? Some black women in the northern KZN have no food and have to eat cow dung to take them.
Okay. That's even more unusual a question than the blowjob, I must be honest. The second line you have to take with food. The first line regimen you can actually take with no food in your tummy. Okay. So it won't do you any harm. You will get adequate drug levels. So,
but if you're on the second line, you must be eating
then you have
something.
to be taking food.
Okay. And we dealt with this, but I think since there's confusion, let's just do it again. My girlfriend is on ARVs and I am negative. Must I use a condom? Let's say it together. Yes. Safe sex, people. That's what's going to save you. Let's leave it there.
Yes, I agree with you.
We'll chat soon. Francesca, great to have you back in the studio. And I'm sure we'll have you back. And I think, as Chris was saying, and again, it is about family and community support. If someone in your family is on ARVs, give them all the support that is possible to give them.
And when they have dark days, remind them how much you love them, and you will support them through the dark days.
And just from having, been in this field for the time that you have you seen a difference, particularly among the patients, when it comes to how they feel when it comes to stigma, for example?
I think so, yes. People are more likely to come forward.
Yeah.
I've done testing out in communities and been very surprised that people will come and volunteer for testing in the middle of a shopping centre. So I think the stigma is decreasing. And people are just thinking, well, I don't want to die of this sickness, so I'm going to go and get my tablets. And there are lots of communities and support groups, both formal and informal, in many treatment sites.
All right, we'll leave it there. Thanks for your time this morning to Dr. Conradi. She's Right to Care's clinical advisor at the Caesar Hospital. That's a hospital for the treatment of multi-drug resistant TB.